Good evening, everyone. Today's topic here will be hyperbaric oxygen therapy for ALS and MND. So, a brief introduction of myself. My name is Dr. Heena. I'm an MD, and I have an 8 years of experience in handling patients with neurological problems. Also, guiding and treating patients for HBOT and ozone and other integrated approach since 2 years. I'm the Chief Medical Officer at KLS Wellness and Neurogenetics, Navi Mumbai. So before we start and go to hyperbaric, just a brief introduction, just a brief knowledge about what is motor neuron disease. So basically, this is a group of neurodegenerative diseases that affects the nerves in the spine and the brain to progressively loosen its function. It's a condition which selectively affects the motor system, that is the cells which control the voluntary muscles of the body. So this is the normal neuron, this is the diseased neuron. Here the affected nerve, the motor neuron disease basically affect the nerves over here, and so the signals which generates in the brain will not be able to come to the motor muscles because the nerve is getting damaged. So there are the different types of nerve cells. Two types of motor neuron disease basically are the upper motor neuron and the lower motor neuron. So normally the messages from the nerve cells in the brain are called as upper motor neuron, and which is transmitted to the nerve cells in the brain stem and spinal cord are called as lower motor neurons, and from there to the particular muscles. As the nerve cells die, the electrical messages from the brain to the muscles starts getting affected, which leads to difficulty in performing motor function. So slowly, the degenerative changes happens in the motor neuron disease patient, like walking, doing activities and talking and swallowing, and eventually breathing gets affected. Over time, the muscle starts to waste, known as atrophy. Each kind of motor neuron disease affects different types of nerve cell. The commonest one is ALS. You all know the treatment. Basically, there is no such cure for MND, but we treat the disease by relieving the symptoms and slowing the progression of the disease and maximizing the patient's independence. Drugs such as Rilutor or Rilutex has been found to be very effective in early stages of MND. Also, autologous stem cell therapy helps in early MND cases to halt the progression of the disease. Then supplementing the patient, because as and when the muscle starts wasting, you have to supplement the patients with proper protein diet and vitamins and minerals and antioxidants. That also works as a boon in disguise. Also, as the muscle starts to degenerate and lose its function, physiotherapy comes into picture, occupational therapy, then speech and swallowing therapy. These all therapies are beneficial in providing their mobility and operation and improving the life glass and metal mixed, where the oxygen pressure is generated to dura, which is 100% oxygen, and the patient stays inside for around 1.5 hours. What is hyperbaric oxygen therapy? So basically, it is providing your body with 100% oxygen. The principle itself says improving oxygenation of the tissue throughout the body with 100% oxygen. What is the difference when a patient breathes at a normal atmospheric pressure, and what if the patient breathes inside the hyperbaric chamber? So normally when we are breathing at present, the oxygen which is carried is through the red blood cells. So red blood cells are the one which is the carrier of oxygen only when we are breathing at a normal atmospheric pressure, which is a pressure of 1. But when we are breathing inside a hyperbaric oxygen chamber, the RBCs as well as, so here also because we are breathing in hyperbaric chamber, this oxygen can reach to those very areas where only the plasma can go. In short, the benefits of hyperbaric oxygen therapy are, it helps in the immunity mechanism, it strengthens the immunity of the patient. As it is like breathing oxygen in the hyperbaric chamber, it stimulates the oxygenation, it provides the body with 100% oxygen. It works on the metabolic process, metabolic pathway, and it improves metabolism of the patient also. So it is also beneficial in metabolic disorders, diabetic patients, and all other metabolic disorders. Also, it helps in weight management. So when you are into hyperbaric chamber and take a continuous sessions of hyperbaric chamber, you will find difference in your weight also. It increases the energy levels because it increases the blood supply of your body, so it increases the energy levels. It reduces fatigues, and it gives an overall boost to your functioning. The physiological functioning are overall. So the process is like when you go inside the chamber, you will feel some kind of pressure inside your ear, similar to the way you feel when you are in a flight. While taking off, the flight takes off, you feel some pressure which is generated in the ears, the popping kind of sensation. The same thing you will feel inside when you are in the chamber, or when you have used an elevator, or when you are in ghats. So you can feel that kind of popping which is there, which you observe inside the chamber. To tackle that, a simple trick is to try and swallow your saliva. What you can do is try to open your mouth wide as if you are yawning, like ah. So that will help in equalizing the pressure inside your ears. So as and when the pressure rises, you will feel a little warmth inside, but as the pressure stabilizes, you will feel calm and composed. The similar kind of popping you will observe when the pressure is declining. Alright. So now there are different studies which shows that hyperbaric oxygen therapy can significantly ameliorate the mitochondrial dysfunction in the motor cortex and spinal cord, and can greatly delay the onset of the disease in animal model of motor neuron disease. Also, recent clinical trials, a lot of clinical trials if you see on the net, which shows the hyperbaric oxygen therapy. These are the which presents our morphology, our biological functioning, our physiological function, all defined by these genes. Now, these genes have a cap on the top of the chromosome. There is a cap called as telomeres. Now, these telomeres are the biological markers of aging. When you age, this telomere starts to get shorter and shorter. As you approach death, the telomere lengths are completely gone. So now there are tests available in the labs which can actually, where you can actually measure your telomere lengths. Definitely because of the environmental stresses, because of the food we eat, because of the mental and financial stresses. The telomeres are the length of the biological age is always more than your chronological age. So this can be measured through your telomeres. But there are different ways nowadays where you can reverse your telomere length by a different integrative approach. One of this is hyperbaric oxygen therapy. There are different studies which shows that the telomere's length can be reversed. The first study which I'll show you is of USA, where around 10 people, so 35 people were taken into consideration, and they were observed for 5 years. So 35 men were observed for 5 years. Intervention group was 10 men. 25 were the control people. Now these 10 people were told to go on a strict vegetarian diet, have to do exercise every day, have to manage their stress. Now stress can be managed nowadays only by yoga, meditation, by avoiding the stresses in their life, and social support every day. So the 25 control group were put into nothing. So they were just living their life as they were living earlier. Only these 10 people were given this intervention. So to our surprise, it was found that the intervention group, which were given all these management, and when the telomeres were observed after 5 years, their telomere lengths were increased. So they were on vegetarian diet, they were on exercise, stress management and social support for 5 years. And there was a significant change in their telomeres length. And the second study, conclusion, the study indicates that the HBOT may induce significant stimulatic effect, including significantly increasing the telomere lengths and clearance of the senescent cells in aging population. That means the theory, the clinical trial which was done in US and Israel, where 10 people were in intervention group and given 5 years of proper management and 60 daily sessions of hyperbaric, was found equivalent. But nowadays, if you say that you want to go on a 5 years of vegetarian diet, it is very difficult to manage this. So vegetarian diet without any oil or without any other you want to eat good, you want to eat tasty food. Exercise is next to impossible for nowadays population. Stress is like you cannot avoid stress nowadays, and social support have become really negligible. So it is really very difficult to be on this diet. But yes, you can go for 60 daily sessions of hyperbaric, or you can go for some time of hyperbaric oxygen therapy, and you will find the same results which you observe in 5-year study. We have few studies. So here we have seen the results on MND patients also with hyperbaric oxygen therapy. Okay, so here we had seen a 62 years old male patient of MND had received 10 sessions of hyperbaric therapy. The chronological age of the patient was 62, and when the biological age was done, that is telomere was done, it was 76 years. That means around 14 years of difference. It was done on 9th March of this year, and when after 10 sessions we have again repeated, it showed 2 years of difference. So within 10 days, the telomeres length have shown reduction of 2 years. Meaning, if you conduct or if you take the sessions for more days, you will find more results in reducing it. This was found in MND patient. The second was in 61 years old female case of MND who received 10 sessions of hyperbaric. Chronological age was 61, biological age was 72. So around 11 years of difference. It was done on 3rd May 2022. When the telomeres were repeated after 10 days, it showed 16th May. It was 70, meaning 2 years of reduction in 10 days, 10 sessions of hyperbaric. Isn't that great? Then again, 61 years old male case of MND, 10 sessions of hyperbaric. 61 years showed 70 years biological age, and after 10 days of hyperbaric, it was 68 years. So you can see the difference of again 2 years and 10 days. So here we had done few cases only on MND, but there are a lot of clinical studies on hyperbaric where you have seen this, where we have seen results of age measuring 2 years to 8 years to 10 years. And the effect of the hyperbaric not just lasts only to the period where the hyperbaric oxygen therapy is taken, it lasts for more than 3 to 6 months. That is the effect of hyperbaric. So if you want to opt for hyperbaric oxygen therapy, what you can do is you can either start with 10 sessions or 20 sessions of hyperbaric oxygen therapy. But if you are including other therapies like autologous stem cell therapy or other therapies like other stem cell therapy, you can just do 20 sessions. But if you're not opting for another surgeries, you can offer 40 sessions of hyperbaric in a row. You can either go for 5 times in a week, or you can get the sessions every day on a daily basis. There are few contraindications to hyperbaric oxygen therapy, like a patient should not have any lung issues in the sense the any kind of lung surgery is done, which is one of the contraindication. If you have pleural effusion, pneumonia, if you have bronchiectasis, or if you have any kind of fibrosis in the lungs, that is one of the contraindication. But if you have recent bypass surgery, or if you have pacemakers installed inside the body, or pacemaker pumps, epidural pumps, that is also one of the contraindication. You should not have undergone any ear surgeries recently, or not. You should not have any grommets inserted inside the ears. Also, if the brain is involved, if there's edema inside the brain, then contraindicated. The HBOT is contraindicated completely. Otherwise, if these things are not there, you can definitely go for hyperbaric. There are few acute contraindication where you should not have fever, cough, cold. You should not have any kind of acute conditions which involves the weakness, a lot of weakness. So you should avoid hyperbaric at those times. Otherwise, all healthy individual or people who have your patients who have MND and early MND patients can definitely opt for hyperbaric oxygen therapy, and definitely they will find results in the coming days. So, conclusion says that hyperbaric oxygen therapy is found beneficial in reversing the biological markers of aging when used in conjunction with the conventional treatment and has the potential to provide better quality of life to MND. Thank you so much.